Greg on the line with a question. Hi, Greg. We're going to go ahead and take that because we're in the last leg of the show. What would you like to ask Dr. Kathy McCabe?
A couple quick things. First of all, what is the cost of the bilateral placement and does insurance cover it? And second is, I'm 51 years old right now, and I had LASIK surgery 15 years ago. And about the first 10 years were great, but since then my vision has regressed. And I was wondering if there are any contraindications to using the lens implant after LASIK treatment. Sure. And how does presbyopia fit into this whole picture?
All right. So 3 parts. The first one is that if you do not have a visually significant cataract, then insurance would not cover any portion of the surgery. If you do have a visually significant cataract, then it would cover the standard cost of doing the surgery and a standard lens, but not the upgraded cost of doing a multifocal lens like what Tanner has. So you may or may not be responsible for the whole cost depending on where or if you have a cataract. I'll talk about presbyopia next, which presbyopia fits into it in the fact that these multifocal lenses allow us to correct the problem with not having any reading vision, whereas LASIK allowed you to see well at distance. As time went on and you lost the ability to focus up close, as we all do in our 40s, LASIK wasn't able to address that. And then your question was whether or not, having had LASIK, you would still be a candidate for these lenses. And maybe is the answer. If you've had a really significant change in the shape of your cornea, it may not be a good idea to put a multifocal lens in there. We may be using some of the alternative lenses I described before. So it's possible you would be. If you had a smaller change to the shape of the cornea, then you may still have that as an option. But if you had a larger nearsighted change or you had a farsighted change to the shape of the cornea, then we'd have to be looking at other alternatives.